Invisible Fence, well, I'm Tom with Invisible Fence. This is Coco. And what Invisible Fence wanted to do was to get oxygen masks in all first responding vehicles throughout the country, just to go with what our goal is, to keep all the pets safe at home. So that's why we're here today. We partner up with a vet, a local vet's office, Town and Country, who also goes in on this with us. And we come on out and we give you a quick demonstration of how things work. Coco's going to be my demonstration dog. Before we show you the demonstration, each kit comes with 3 masks, and every mask is set up with its own hose. So you don't need to switch hoses around. These are all designed to hook up right to your existing oxygen equipment. There's a flow chart right in with each kit, but as you know, it's pretty simple. I mean, the flow chart is specifying 1 to 3 liters, 3 to 5, 5 to 7. Bottom line is just getting oxygen flowing, okay? They have the discharge valve, so there's really no way of over-oxygenating the pets. And kind of the first question I like to ask is, can anybody tell me which mask, how you determine which mask you're going to use for which pet? They come large, medium, and small. And basically it's all gone by muzzle size, okay? You'll find if you get like a Boston Terrier or Bulldog, you know, a much smaller breed, but they have a huge nose, okay? So then you're going to want to use the bigger mask, not the smaller mask, just because they're smaller. The other nice thing about these is with the pets, basically you just want to get oxygen flowing, okay? Bottom line. And you can peel these rubber gaskets off from these if you need a bigger circumference just to get around the nostril, okay? These are all cleaned with soap and water, okay? Same with these, you can put them right back on. Some of the things you want to remember is when you're dealing with a dog and a cat, it's just like dealing with a person. And what I mean by that is you find them unconscious in the house and you bring them out. Obviously, you want to try to get the homeowner, and the homeowner is going to be right on top of you to begin with, okay? But homeowners and people will push you away when they come to. Dogs are going to bite, okay? That is just their natural instinct. It's not an aggression thing. It's just they're scared. So you need to make sure you have them restrained. Coco, come here. Come here. Come here. So a couple of things you want to do. Come here, Coco. Come here. A couple of things you want to do is all of the kits come with this leash right here, okay? The nice thing about the leash is when you bring them out, just lightly wrap that around their nostril a couple of times. That way you're muzzling them. So when they do come to, they can't get at you and bite you, okay? Because we want to prevent bites. And then the other thing is that you'll take your mask and just simply slide it right over the nostril, okay? Just like so. With the rubber grommet on there, it obviously fits in there a lot more snug. The masks are designed with the tube to hook right up onto your oxygen tanks themselves. You can also hook up your bags to them as well. By hooking up the bag, you're just going to pull this grommet right out of there. So it's in every one like so. Pull that out, and you can hook the bag right up to it. What you're going to find is that the homeowner, when you bring the pet out, if the homeowner is okay, they're going to be all over you. So the best thing you can do is to have the homeowner right there beside you, talking to the dog, very toned, nice toned voice. The other thing, like little kids, you know, you're not screaming at little kids when you're talking to them. If you can talk in an even tone. Dogs are trained and taught right out of the gate by their parents with growls and nips. So when you're dealing with them and they come to, you know, it's not, oh, good boy, good boy. You know, a rough, growly voice sounds like a growl, you know. Calm voice, good girl, yeah, that's a good girl. And they'll respond a lot more better, a lot more positive if you can drop that tone down, okay? Lay down. I haven't taught her to lay down yet, so I just gotta put her down. A lot of people ask on compressions, chest compressions for dogs. what you want to do is you want to kind of take their elbow right here onto their chest, and that's where you're going to be doing chest compressions if you do it. From what I understand, if they don't come to with the oxygen flowing, they're pretty much not going to come through at all. So chest compressions are something that are kind of a moot point, but that is your kind of your guideline of where you want to go. From what I understand, their heartbeat is similar to an infant, very quick. So you want to put your hand on both sides. You just want to go right in there. To check for a pulse, you want to come right in here, and there's a muscle right there that you can feel, and you can feel the pulse going right there. And it's right here. And that's going to be your best place for if you want to check a pulse on a dog. All right? And cats, last but not least with cats, by far the most important thing you can do is get a towel and wrap them up like a taco. When you're dealing with a cat, they're going to claw you and scratch you, and they're going to go absolutely berserk if and when they come to. So you just want to make sure with them you can restrain them with a towel, and like I said, you wrap them up like a little taco so their head's exposed and everything will be good. With the dogs, again, you can use the leash to wrap around the nose, and you just want to make sure the homeowner is right there with you. And in a nutshell, that is what we're talking about. Anybody have any questions? It's pretty, you know, it's funny because, it's not funny, it's unique because people used your human oxygen masks that you had to get oxygen going to pets, and what they found was that just by getting the oxygen flowing through the pet's system was bringing a lot of pets around that they thought were not rescuable, so to speak. Kind of how the process came up. We had a vet on Plainfield in Grand Rapids had a fire in her house, their house, and they actually revived 2 of her dogs with the oxygen masks. So they are proving to be a pretty positive, and they're doing what they're designed to do. And our goal is to get one in all the first responders.
I assume if we're going to use a BVM, we just guess at the size BVM to use based on the size of the animal. I mean,
The size of the muscle.
When you talk about the BVM, so
Yeah.
right here, right? So you have different sizes of these?
Yeah.
Yeah, that would be something, I guess you have to wing it. But again, the bottom line is, it's just getting oxygen going, just getting an airflow through there, you know, is what we find is really beneficial.
But can't you say that was a thing on there to where you can't get too much oxygen to them?
Correct. And with the BVM, because you are pumping it, you may need to hold your hand or your fingers over the discharge because you don't have an abundance of oxygen flowing in there in that situation. And as you can see, I'll show you right here. Coco, come here. Sit. Good girl. So just to show you, your oxygen flow is like so.
What locations would be available to us to kind of inform family members of where to go, especially after?
Sure, after hours, yeah. So the Animal Emergency Hospital on Plainfield in Grand Rapids. Probably can give you the phone number.
Yeah, it's up by 4 Mile, right?
Yeah, it's Plainfield, just before the expressway.
Yeah, it's up
Yeah.
by 4 Mile on the south side of the road.
Okay, thank you.
Yeah, the other one is, it's called Blue Pearl now, which is the dumb name. It used to be called Michigan Veterinary Services. There's another place called Michigan Veterinary Specialty, but it's now called Blue Pearl Group, which doesn't really tell you what they do, but they also have emergency service. And they're on Michigan Avenue. They would be about a mile and a half east of what used to be Butterworth Hospital.